Alright, so we're looking at urinary incontinence. Alright, urinary incontinence. So urinary incontinence just have to do it. You are feeling like you want to urinate and you can't hold it. The urine just drops, you know. So urinary incontinence is the what? Involuntary loss of bladder control. You don't have any control over your bladder anymore. You know, you can't like hold urine, you know, everything just drops like that. Alright, so this is what? Unintentional leakage of urine. Right, so it's a common condition that affects people of all ages, but it's more prevalent in women and also people that have aged though. Alright, okay, so the types of incontinence is this, have different types. It could be that it's stress, you know, so anytime the person is stressed, they kind of like lose control of their bladder, but when they rest, it's okay. Alright, urge incontinence, that on a sudden intense urge, like where you want to urinate, the urge is too much. Overflow incontinence, functional incontinence, mixed incontinence. Alright, so causes and risk factors is this: weak pelvic muscles, menopause, right, enlarged prostate in men, neurological disorders like Parkinson's, stroke, urinary tract infections, certain medications like diuretics, you're taking diuretics, you know, obesity, chronic cough or constipation. Right. So diagnosis, now if you go to the hospital, they will ask you a lot of questions. When. You understand? From the questions they are asking you, they will pick out the type of incontinence. Alright? Is it when you are stressed? They'll ask you all those kind of things. Physical examination too. They'll check, you know, they'll tell you to enter the hospital screen. They'll now undress you, they'll check everything. Urinalysis or urine culture, bladder diary, okay, then urodynamic testings. So treatment options is this: lifestyle and behavioral therapies, okay, bladder training, daily urination to increase bladder capacity, scheduled toilet trips, fluid and diet management. The pelvic floor exercises just to strengthen the structures there again. Hygge exercises to also strengthen the pelvic muscles. Medications like what? Anticholinergics, you know, vaginal estrogen for postmenopausal women. Pessaries, those ones are just devices that will insert into the vagina to increase the support. Alright, then surgical options, they can do sling procedure just to support the urethra again. Bladder neck suspension, this one is basically for surgeons. Alright, artificial urinary sphincter, but just saying it in case you hear them talking about it in the hospital. So that's just it for urinary incontinence.